A 68-year-old woman walked into my hospital on a bright Tuesday morning for what she was told was a routine, low-risk spinal procedure. She was promised it would fix her chronic back pain so she could finally get back on the floor and play with her grandchildren. Instead, the heavy anesthesia and the intense physical trauma of the operation triggered a sudden cascade of severe cognitive decline and extreme chronic fatigue. Within 6 short months, she lost her independence entirely and was moved into a full-time nursing facility. She never got to play on the floor with those kids. As a cardiothoracic surgeon who has spent a decade opening chests and holding beating human hearts in my own hands, I know exactly what the trauma of a scalpel does to the human body, and I know exactly what it does to a body that has lived and worked hard for 6, 7, or 8 decades. The harsh reality that gets completely ignored during those rushed 7-minute clinic visits is that after the age of 60, the hidden risks of going under the knife multiply exponentially. There are 3 specific, highly common surgeries being pushed onto seniors every single day. Procedures that often cause far more irreversible harm, mental fog, and physical deterioration than the actual condition they are meant to treat. The 3rd surgery on my list is so incredibly routine, your doctor might have already recommended it to you this very year. I am going to reveal exactly what these 3 dangerous procedures are, why the guidelines pushing them are dangerously outdated, and the natural, non-invasive alternatives you need to discuss with your physician immediately. I am Dr. Marcus Caldwell. Over the last decade as a cardiothoracic surgeon, I have stood on the front lines of modern medicine, navigating the delicate line between life and death on the operating table. I have seen the miraculous things surgery can do, but I have also seen the devastating, irreversible damage it can inflict when used unnecessarily on older patients. I grew profoundly frustrated by a medical system that restricts our appointments to a mere 7 minutes, a system that rushes you out the door with a hurried surgery date instead of sitting down to explain the real risks and the natural alternatives. That is exactly why I created this channel, to give you the time, the honest truth, and the power that the traditional system denies you. If you are ready to stop being treated like just another number on a chart and want to take absolute control of your health, hit that subscribe button right now. Give this video a thumbs up and click the notification bell so we can continue this journey together. You need to understand the true underlying issue here, because the real reason these invasive procedures are pushed on you might shock you, and it is something we need to talk about right now. You sit in that sterile waiting room for an hour, finally get called back, and then you are rushed through a 7-minute consultation. Your doctor looks at your chart, sees joint wear, arterial plaque, or spinal compression, and immediately suggests sending you to the operating room. They do this because they are strictly following a rigid set of clinical guidelines. But here is the dangerous truth those massive medical binders hide. Most of these surgical protocols were written decades ago, and they were primarily designed and tested on robust 30- and 40-year-old bodies. They completely ignore how a 65- or 80-year-old biology actually responds to the brutal shock of general anesthesia, massive tissue disruption, and heavily narcotic recovery phases. The system operates on an outdated assembly line mentality where the scalpel is viewed as a universal quick fix, regardless of your birth year. It treats a symptom by simply attempting to cut it out, rather than understanding the delicate, interconnected ecosystem of a maturing human body. If you have agreed to a risky procedure in the past, or if you are currently scheduled for one and feeling a deep sense of dread in your gut, I need you to hear my voice right now. This is not your fault. You did everything right. You showed up to your appointments, you trusted the white coat, and you followed the instructions you were given. You genuinely believed that the medical system had your long-term quality of life in mind. You were simply doing your best with the limited information provided to you. But the system failed you. It failed to give you the context, the time, and the truth about how these invasive procedures can permanently steal your independence. It failed to tell you that your body has a profound, innate capacity to heal, stabilize, and manage wear and tear without being cut open, provided it is given the correct natural support. The physical mechanics of why your body reacts so violently to surgery after 60 are fascinating, and understanding this biological shift is the ultimate key to reclaiming your autonomy. Let me explain exactly what happens inside your tissues as you age, because it changes everything. When I stand in the operating room and make that first incision, The difference between a 30-year-old body and a 70-year-old body is not just a matter of age. It is a completely different biological landscape. I need you to understand what is happening under your skin right now, because this knowledge is your absolute armor. As we cross our 60th birthday, our cellular biology undergoes a profound systemic shift. We enter a state of natural, low-grade inflammation. Your tissues, your blood vessels, and your central nervous system are no longer focused on rapid growth. They are focused on preservation. They have adapted beautifully to the decades of wear, tear, and stress you have survived. But when a surgeon introduces a scalpel into that delicate ecosystem, it is not just a localized event. It is a biological earthquake. Think about the immense trauma of general anesthesia. When the anesthesiologist pushes those heavy synthetic chemicals into your intravenous line, your brain does not just go to sleep. It is forced into a profound medical coma. For a young brain, the chemical fog lifts relatively quickly. But for a brain that has accumulated 60 or 70 years of neuroplasticity, those synthetic compounds linger heavily. They disrupt delicate synapses. This is exactly why so many seniors wake up from routine joint or back surgeries suffering from severe mental confusion, sudden memory loss, and a crushing, inescapable fatigue that lasts for months or even years. The surgery might have fixed the knee or fused the disc, but the invisible cost is your cognitive sharpness. You trade a localized physical pain for systemic, life-altering brain fog and chronic exhaustion. Then we have the physical healing process. When you cut through fascia, muscle, and nerve endings in an older body, you trigger an overwhelming inflammatory cascade. Your immune system rushes to the site of the trauma, but because your body is already managing that natural low-grade inflammation of aging, it violently overreacts. This hyperinflammatory response leads to excessive scar tissue formation. That dense scar tissue wraps around sensitive nerve roots. It severely stiffens the joints. It creates entirely new pain pathways that did not exist before the operation. You went in hoping to relieve your pain, and you walk out with a body that feels rigid, traumatized, and deeply weakened. Your fear of losing your independence, of ending up bedridden or in a nursing facility, is completely valid and rooted in hard medical reality. This is the silent epidemic happening in recovery wards across the country. To truly grasp why this happens, consider this analogy. Think of your body after 60 not as a simple machine, but as a magnificent, historic suspension bridge. Over the decades, some of the steel cables have naturally frayed. The heavy bolts have settled. The massive structure has shifted, but it has found a perfect, delicate balance. It still carries the traffic of your daily life. It still stands strong because every part has adapted to support the others over time. Now, imagine a crew of engineers showing up, deciding one specific cable looks worn, and completely tearing it out to replace it. The sudden shock of that violent removal destabilizes the entire bridge. The weight violently shifts to the surrounding older cables, causing them to snap under the sudden new pressure. The aggressive attempt to fix one small part brings the entire structure crashing down. This is exactly what unnecessary surgery does to your spine, your knees, and your cardiovascular system. The medical literature proves this unequivocally. A sweeping, long-term clinical study monitoring older patients undergoing elective, non-emergency surgeries revealed a terrifying truth. Within 12 months post-operation, nearly 40% of patients over the age of 65 experienced a significant, measurable decline in their ability to perform daily, independent activities. They struggled to walk upstairs. They had trouble managing their own finances due to cognitive decline, and their overall quality of life plummeted. The medical intervention that was supposed to give them their life back actually accelerated their physical decline. It is a devastating cycle of treating the isolated symptom while completely destroying the whole patient. But you do not have to become a statistic in a medical journal. You do not have to accept the false narrative that the only path forward is to let a surgeon cut into that beautifully adapted suspension bridge. Your body possesses an incredible, untapped ability to manage inflammation, stabilize joints, and heal damaged tissues without invasive trauma, even right now at your current age. By making specific, targeted adjustments to how you move, how you breathe, and how you support your cellular health, you can dramatically reverse the damage and support your biology naturally. There are natural, simple, incredibly effective ways to achieve the pain relief and mobility you desperately want. I am going to show you exactly how to bypass the operating room using a protocol you can start applying today from the comfort of your own living room. The steps I am about to share are going to fundamentally change how you protect your heart, your brain, and your joints forever. The medical system wants you to believe that once a joint wears down or an artery stiffens, the only answer is to cut it open, often leaving you feeling rushed and treated like just another number. They completely underestimate the regenerative power of a senior body when you remove the chronic stress that is breaking it down in the first place. You do not need thousands of dollars in treatments, but rather natural and simple solutions like 60-second tricks or breathing techniques that replace the need for those extreme measures. You need a targeted daily protocol that supports your biology, manages inflammation naturally, and stabilizes your physical structure. I call this the biological preservation protocol, and it consists of simple, actionable steps that cost absolutely no money. Step 1 is the morning nervous system reset. When you wake up, your body releases a massive spike of cortisol. For a younger person, this is just energy. But over 60, that cortisol spike violently constricts your blood vessels and ramps up joint inflammation. Before your feet even touch the floor, I want you to perform a physiological sigh. Inhale deeply through your nose for 4 seconds. Take one more sharp inhale to fully expand the lungs, and then exhale slowly through your mouth for 8 seconds. Do this exactly 5 times. This specific breathing pattern immediately overrides your sympathetic nervous system, gently lowering your blood pressure and halting that morning inflammatory cascade before it can settle into your spine and your knees. Step 2 involves lubricating your internal scaffolding. Forget the expensive joint supplements. Every evening, about an hour before you sleep, brew a simple nighttime tea made of ginger and turmeric, but add a heavy pinch of black pepper and a drop of olive oil. The black pepper increases the bioavailability of the curcumin drastically, and the fat from the oil carries it directly across your cellular membranes. This acts as a powerful, natural solvent for the dense, sticky inflammation that locks up your hips and back overnight. You wake up with tissues that are pliable and ready to move, rather than stiff and aching. Step 3 is mechanical stabilization without the wear and tear of heavy exercise. We talked about your body being a beautifully adapted suspension bridge. To reinforce that bridge without traumatizing it, you need isometric activation. Once a day, sit in a sturdy chair, place your hands flat against your thighs, and push down as hard as you comfortably can while simultaneously trying to lift your knees up against your hands. Hold this intense tension for exactly 60 seconds. You are not moving the joint, so there is zero friction, zero grinding, and zero damage to the cartilage. But that 60-second hold sends a massive signal to the deep, stabilizing muscles around your spine and pelvis to wake up and grip the bone tightly. It builds a natural muscular corset that supports your skeleton, completely reducing the painful load on your vulnerable joints. Step 4 is perhaps the most critical for your brain and your heart, involving specific sleeping positions to allow your central nervous system to repair. The angle of your neck at night dictates the flow of cerebral spinal fluid, which is your brain's natural washing machine. If you sleep with 2 heavy pillows propping your head up in a steep forward angle, you are kinking the cervical artery and blocking that vital fluid. This leads to that severe morning brain fog and increases the risk of overnight cardiovascular events. You must sleep with a single firm pillow that keeps your cervical spine perfectly neutral, aligned with your thoracic spine. This unbroken alignment allows your body to effectively clear the metabolic waste from your brain and keeps your blood oxygen levels stable while your heart rate drops. The biology behind why this protocol works is profound. When you utilize the breathing reset and the neural alignment, you are actively bringing your entire system out of a state of chronic defense. You are dramatically lowering the circulating inflammatory cytokines that eat away at your cartilage and stiffen your vascular walls. You are teaching your muscles to bear the weight of your body, taking the pressure off the fragile discs and meniscus. You are giving your cells the exact environment they need to heal, to reverse the damage naturally, and to thrive without chemical or surgical intervention. You desire honest doctors who treat the root cause and not just the symptoms, and this protocol gives you the power to demand exactly that. You have the power to change your trajectory today. I want you to write these 4 steps down on a piece of paper. The next time you are sitting in that clinic and feeling pressured to sign a consent form for a surgery you are terrified of, I want you to pull that piece of paper out, look your physician directly in the eye, and advocate for yourself. Ask them to give you 60 days to implement this natural preservation protocol. Ask them to have a real conversation with you to see if that invasive procedure is absolutely, undeniably necessary right this second, or if you can take the time to support your biology first. You are not a passenger in your own body, and you do not have to surrender your independence to a rushed system. But there is one final crucial thing you must understand before you make any decisions regarding your current medical plan. Now, I need you to listen to me very carefully. The information I am sharing with you today is meant for general educational purposes. I am a surgeon, but I am not your personal physician, and I do not know your specific individual medical history. Please, never suddenly stop taking your prescribed medications or abruptly cancel a scheduled procedure without having a serious, face-to-face conversation with your own doctor first. I want you to use this video and the knowledge you just gained, not as a replacement for medical care, but as a powerful tool to have a much better, more informed conversation with your provider. Work with them to see how you can safely implement these natural steps. But our work here today is not quite finished. I want to hear directly from you right now. Go down into the comments and share your personal experience with me. Tell me, what is your systolic blood pressure today? Your story might be the exact validation another person needs to read to realize they are not crazy and they are not alone. Please, I am imploring you, do not keep this life-saving information to yourself. Share this video right now with your spouse or a friend who is over 60 years old. Spreading this message is a matter of absolute urgency and public utility. If you felt heard and empowered by our time together today, hit that subscribe button, like this video, and turn on the notification bell so we can continue to bypass the traditional system together. You have taken a magnificent step today in protecting your body from the brutal trauma of the operating room, but our work is not quite finished. There is another hidden, silent danger lurking in your daily routine. In fact, there is one incredibly common thing you do every single morning that is quietly destroying your arterial walls and skyrocketing your risk of a sudden cardiovascular event. I reveal exactly what it is and the simple way to fix it in the video popping up on your screen right now. Click that video, keep taking control of your biology, and I will see you over there.